Hello everyone. So in this video I am going to talk about the topic that is transverse myelitis. Transverse myelitis, it is a rare neurological disorder. It is an acute or subacute disorder that leads to inflammation of myelin sheath around the spinal cord and affect the one segments of the spinal cord. Okay, so it generally leads to inflammation of the myelin sheath of the spinal cord, and it affect the one segments of the spinal cord. So mostly it affect the upper thoracic region. Okay, mostly it lead to severe motor and sensory and autonomic dysfunction. Okay, it leads to severe motor, sensory and autonomic dysfunction. So it is about definition. Now we talk epidemiology. Okay, general rate. So generally it happen into 1 to 4 in every million of children per year. Okay, so it is rare condition. Now it affects generally all age group, older children, adult, but most common that is 10 to 19 year and 30 to 39 year age people. Okay, which are mostly affected. Now we talk its etiology, or we can say it is a causes. So generally most common cause, that is it is a post-infectious, and second that is a post-vaccination. Post-infections, that means in that viral infection is very common, like respiratory and GI infections, okay, from virus. So this is a common causes. Second, post-vaccination in the tetanus, diphtheria, hepatitis B, and rubella vaccine. This type of vaccination, after that, due to some reason, the myelin sheath of the spinal cord which can get affect, and it produce a transverse myelitis. Then MS people, that means multiple sclerosis. It is a autoimmune disorder, in that also transverse myelitis, which is very common in these people. Then direct invasion of spinal cord. Okay, if some in some surgery. Okay, so direct invasion of the virus and bacteria into the spinal cord, so which produce infection and that affect the myelin sheath. Then some autoimmune disorder like SLE, that is a systemic lupus erythematosus, that is also autoimmune disorder. And the second, that is a Sjogren syndrome. Generally Sjogren syndrome may what happen, dryness of mouth is most common symptoms, dryness of mouth, and it is also autoimmune disorder. So this condition also are causes for the transverse myelitis. It occur after infection like rabies and smallpox. Okay, now the types, or we can say uh, classification. So there are four classification according. First is complete transverse myelitis, second that is incomplete transverse myelitis, then acute and subacute. Now we talk about complete, that means the myelin sheath which affect the whole the spinal cord. So we can say it is a complete spinal cord, in that generally all sensation are affected. Then we talk about the incomplete, in that half of the spinal cord ની જે myelin sheath હોય છે that affected. In acute, so the symptoms start within a minute or after hours of the infection, and in subacute transverse myelitis it take a time of the day or some week. Now we talk about the stages. So it has generally three stages. Okay, total three stages. First is initiation of the disease, then second plateau, and third is recovery phase. So graph में हम देखें, so it is the initiation of disease, in that motor loss, sensory loss and autonomic dysfunction can seen, and it starts after 2 to 3 days of the infections or the post vaccinations. Then some plateau stages come, and then after it recovery phase. So recovery phase generally it is a 4 to 6 months. Okay, so transverse myelitis ની જે recovery છે એ સારો છે, prognosis is good in this disease. Then we can talk about the clinical manifestations. So first we can say in that motor, sensory and autonomic dysfunction is involved. So motor clinical features માં આપણે જોઈએ, so paraparesis, that means in acute condition paraparesis is seen, and if disease progression, so paraplegia in both lower limb. Then muscle tone which is increase, deep tendon reflex, that is hyper reflexia is present. Then lower limb is more involved than the upper limb, and Babinski sign which is positive. Next we talk about some sensory symptoms like pain and temperature which is loss in acute case, but if it is in chronic case, okay, so vibration, kinesthesia also get affected. Then neuropathic type of pain because nerve is also injured. Then paresthesia and abnormal sensation like burning and tingling, mostly in lower limb it is present. Then some autonomic sign and symptoms, that is a bladder dysfunction, bowel dysfunction, hypertension, and due to that tachycardia is present in. Okay. So now we talk about some other symptoms like spine become tender due to inflammation. Then pain localized, and it is generally at the back and neck region. Headache which is present, and fever due to infection. Okay. And muscle spasm. Okay, so in muscle spasm generally spasticity is seen, so we cannot perform MMT, so we do a voluntary control grading in patients. So these all are about the clinical presentation. Okay. Now we see just quick revision. In transverse myelitis, we see definition. Okay, so it is a rare condition, neurological disorder, inflammation of myelin sheath occur. Okay, name suggests the definition. Then we see epidemiology. So 1 to 4 children get affected per year. All age group can affect, but 10 to 19 year and 13 to 39 year age is more common. Causes, so that is a post-infection and vaccination like rubella, hepatitis B, diphtheria, and tetanus. MS people is affected. Autoimmune disorder like SLE, Sjogren's syndrome, in that dryness of mouth is happen. So this type of autoimmune disorder patient also exposure to the transverse myelitis. Then types ની વાત કરીએ, so types complete, incomplete, acute and subacute type. Then we talk about stages. So initiation of stage, play 2 and recovery phase. Initiation, play 2 and recovery. So recovery occur into 4 to 6 months. Okay. So prognosis is good. Clinical manifestation, motor, sensory and autonomic. Motor has paraparesis if it is acute, if it is a subacute, and so in that paraplegia of both lower limb. Tone which is your increase, deep tendon reflex, hyperreflexia. Lower limb more involved than upper limb. Babinski positive. In sensory function, pain and temperature loss, but if it is a subacute case, the dorsal column sensation is also affected. Then neuropathic pain due to nerve involvement, paresthesia, abnormal sensation like burning, tingling, etc., mostly in lower limb. Then autonomic clinical manifestation, that is bladder dysfunction, bowel dysfunction, hypertension, and tachycardia. And other symptoms include spine become tender due to inflammation, pain at localized like back and neck region, then headache and fever due to infection, muscle spasm. And if it is a muscle spasm spastic patient, so you cannot perform MMT, so you go for VCG, that is voluntary control grading. In next video we talk about differential diagnosis, investigation and treatment. Thank you.